Welcome to Dialogue. India is struggling with a devastating second COVID-19 wave, and scientists are warning a third wave is only inevitable. Plus, neighboring countries like Nepal are facing their new surges too. Is a double mutant virus variant behind India's record surge? What practical solutions are there? And how can other countries, on one hand, help India but also protect themselves? To discuss all these issues and more, I'm joined by Dr. Megan Rennie. She's an emergency physician at Brown University. Dr. Netra Prasad Timsina is chairperson for the Ad hoc Central Executive Committee of the Nepal Red Cross Society. And later on, we're joined by Dr. Vikas Pachai, professor at the Center for Social Medicine and Community Health at Jawaharlal Nehru University. It's our topic. I'm Wang Guan. Dr. Timsina, let me go to you first. Nepal is seeing its own surge in cases. You've said that what's happening in India right now is a horrifying preview of Nepal's future. Why did you say that?
No, Nepal, the cases, because Nepal and India has the open border we have, and then Nepal, and then there is the mobility of the people and goods in both countries. Nepal is already in a similar situation of what is happening in India now in terms of the all the infections and then crowd in hospitals. So it is like that. Everybody in our capital city in Kathmandu, in every household have the infected people. Hospitals are already full. And then there is no place for the patients, and COVID patients are being treated in the hospital corridor. So I think it is already like what we see in India. The Nepal has got a less attention, global attention, but it is in the fact that Nepal is already a kind of the more or less similar cases. So more or less similar situation. So I have said in a couple of media, and then with the international federations, the Red Cross Federation, that Nepal is in a critical situation. Given the context of that, the India, if the India, this COVID infection is not contained in India, Nepal also continue to grow. Because of all the mobility, and then mobility, there is the surveillance already put in the border area, no open border area, but still there is no capacity. Thousands of people come and go, particularly enter into Nepal, and a few hundred people go to the India, because in Nepal there is the Indian workers as well, and then Indian people, traders, no business people, they are here in Nepal as well, and they go and come. So it is very difficult to put the surveillance as well, because of it came abruptly, because in the Nepal, because Nepal was not prepared to tackle the what is called the level of the critical situation we have.
But Dr. Timsina, we know that Nepal is a landlocked country, and many of the supplies of Nepal in Kathmandu, where you're now, often come overland from India. But right now, India needs all the medical equipment by itself. What sort of difficulty is this presenting for Nepal's medical system?
No, Nepal because Nepal government is trying to manage human resources to somehow deploying the retired medical professionals and also university students to make the treatment of the COVID. However, we don't have the equipment. We don't produce any equipment and any medicines. So we are very, very critical situation. We we are in scarcity of the oxygen cylinders. We are producing somehow the oxygen gas. But if the India will not supply the raw materials, and we will be in shortage of the oxygen gas as well in a few weeks to come.
Yeah.
But we already in shortage with the cylinder gas, and then India has completely stopped to supply, to provide the cylinder gas. And Nepal government has recently, the day before yesterday, make an agreement with the Chinese government, a couple of thousand of the gas cylinders. So this is a very grave situations that, and then how India will cope up the situations depends upon the Nepal as well, because there we don't have the ventilators anymore. We don't have the what is called the other equipment, other supplies. Even though we will be lacking the sanitizers and then masks, okay, face masks, etc., etc. Even the PPE, surgical masks. So this is the situation. Though that will put if the India continue to be in the like present situations, Nepal will be also in a big pressure of that, not only because of the COVID infection, but also for, because of the supply of the essential materials, including medical supplies.
Yeah, this is a really tragic situation and unfortunate as well over there. Praying for a quick turnaround. Dr. Rennie, from your point of view, how bad is the situation in Nepal right now, and what is the risk for Nepal to become, to follow India's tragic and unfortunate footsteps?
I think there are two big risks for Nepal. The first is that, like most of the world, the majority of the population is not yet vaccinated. And we know, we have 15, 16 months of evidence that when folks are not vaccinated, this virus spreads like wildfire. The second problem, as you said, is that Nepal has limited access to medications, to critical supplies like personal protective equipment, masks, gowns, gloves to protect the medical workers, or that incredibly important equipment, things like oxygen cylinders, sure, but also all of the other medical equipment that we use to take care of critically ill patients. They have limited access to that even in normal times because, as you say, Nepal is landlocked. All of their supplies and medications have to go through India. And right now, India is hanging on to everything it can keep. It's the same situation that we were in last spring when the pandemic was at its worst in China and Italy. And so much of the personal protective equipment was being held onto by Southeast Asia appropriately because you needed it. And we in the United States could get virtually nothing. So I'm quite worried for the people of Nepal. The last part is that we know that when the virus spreads unchecked, when healthcare systems get overwhelmed, that's when the mortality rate from this virus surges. It is a horrible virus even in a functioning healthcare system, but when you get overwhelmed, you can no longer provide that basic life-saving care, and folks are going to be more likely to die.
Yeah, there has been this very...
I hope that the Nepalese can get vaccines. Mm-hmm.
Yeah, there has been this very aggressive vaccination campaign since Biden took office. As he promised, he delivered the hundreds of millions of doses to the American population. What are really the experiences and perhaps the lessons too that America can offer to our friends in Nepal and in India as well?
Yeah, so the first thing is that you need access to vaccines in order to be able to vaccinate. At the beginning of the vaccination campaign, we didn't have enough, and we had to tier access to vaccines according to one's likelihood of getting sick. So we gave it to healthcare workers and to the elderly, particularly to those living in nursing homes or other long-term care facilities first, because those were the people who were most likely to get sick and die. Once we got past that, then it became about tiering the access to groups that were high risk and going down the list and trying to make it easy for people to sign up if they were high risk. But that first and biggest thing is getting access to the vaccines. I know that there are a number of global consortiums working on making that happen. The United States is stepping up and providing supplies that we have on hand, as well as working with the World Trade Organization to advocate for lifting of patents so that we can get vaccines in arms across the globe a little more quickly.
Yeah. Dr. Tim Sinha in Kathmandu, let me go back to you. What chance do you think there is for Nepal to procure enough life-saving medical supplies in the face of its surging COVID-19 cases? What kind of help is Nepal needing right now?
it is very difficult terrain in Nepal, and then Nepal government is exploring if the oxygen cylinder can be procured from China, because China, but still there is only 2,000, around the 2,000 are booked, but we need more than 25,000 cylinder for the few more weeks to come. Don't know if the COVID, the infection is continue to escalating in Nepal, then we need maybe more than 50,000 cylinders. That is the one problem that we have, but there is the one with the China, and then also we are facing the vaccination, no? Because the India promised to provide vaccines to Nepal, somehow 5 million vaccine, 5 million doses. But what happened in between, because of the Indian uncertainty, it was stopped, and then no vaccine is available, and then Nepal government is exploring if the Sputnik, now to Russia, can be approached to Russia. So there is a government level, foreign ministry, and then the ambassador of the Russia in Nepal, they have the dialogue. So they are exploring, but the medicines, equipment, maybe we need the ventilators. Ventilators are very essential, and then because the clinical treatment is very necessary, though the public health is also important. Now already many people are infected, so ventilators might be okay, procured from elsewhere, but medicine is not what is called the composition of medicine is very important for Nepal. All the medicine we used to for the last many 50, 100 years we depend with the India. So let us see, because Nepal is very in critical situation in terms of the supplies, and then
Right.
chances or opportunity to procuring from third countries, and then also very expensive, no, we have to bring all them via aeroplane. With the India only, we were trying, we used to do the land transportation, and then we are very serious scarcity the remdesivir medicines, and then India now stopped that to supply to any other countries, not only Nepal. Nepal government is trying to bring from Bangladesh. Bangladesh is quite easy, but Bangladesh is also facing itself in crisis. So many equipment and the medicines, it is not possible from Bangladesh. So we are in the trap somehow, and trying best our government
Yeah.
to approach the third country.
Certainly, our thoughts and prayers are with the people in Nepal. Take care of yourself there. Dr. Netra Prasad Timsina, chairperson for the Ad hoc Central Executive Committee of the Nepal Red Cross Society. Thank you so much for joining us tonight. And
Thank you
Dr.
very much.
Yeah, Dr. Rennie, let me continue with you. How dangerous do you think is the double mutant variant that was detected in India, and how much the current surge there is driven by this new variant?
Oh, it's a great question, and I don't have a straightforward answer for you. We're certainly watching this new variant, and to be clear, the new variant has a number of mutations, but there are these two mutations in particular which may make it more transmissible or more deadly. We don't yet know. It's a variant of interest. It has not yet been demonstrated to be responsible for the surge. Equally important in the minds of most public health professionals and physicians has been the lifting of all of those regulations that we've used for the past 15, 16 months to keep COVID under control. Over the last couple of months, India thought that they had escaped the worst of COVID. They lifted mask mandates. They allowed huge public gatherings, right? Political rallies, religious celebrations, etc. That set the stage for this virus to begin to spread. And we know how COVID works. Once it starts to spread exponentially, right, the line goes almost straight up, especially in a country like India where there are so many people and folks live so close together. It's a perfect situation for a small ember of COVID to take off and turn into the wildfire that we're seeing right now.
Right. Talking about India and their surge in cases, cases dramatically increased over the past weeks. And on Thursday alone, you probably have heard by now, the case number jumped to over 400,000 on Thursday alone. I mean, I think it's useless to talk about what should have been done, but what should the Indian government do going forward to save lives?
So the first and biggest thing is that they have to stop the transmission of the virus. Yes, we need to vaccinate, and every country in the world has to help vaccinate India, but also other countries, right? But vaccines are not going to be an immediate fix. If people get vaccines in arms today, they're not going to be protected for somewhere between 2 and 6 weeks, depending on what type of vaccine they get. So what India needs to do today is to put policies in place for people to stay home, wear masks on those essential outdoor excursions to get groceries or to buy essential medications, and to shore up their medical system so that they can take care of the people who are already sick. People are dying unnecessarily because there are insufficient physicians, nurses, oxygen, personal protective equipment, and so on. And that's something the government can do today.
Right. Right now, we have Dr. Vikas Bajpai, professor at the Center for Social Medicine and Community Health at Jawaharlal Nehru University. Sir, thank you so much for joining us. Our thoughts and prayers are with the people of India who are suffering this. Going forward, I want to ask you the same question that I asked our expert in America, Dr. Rennie. What should the Modi government do to really prevent this virus from going further?
See, insofar as virus is concerned, I think today the government's own scientific advisor has said that the virus is there in a huge load already in the community. And I would tend to agree with this aspect of his, though there are very many differences otherwise. And I think what the people are really dying because of right now is non-availability of treatment to the people. Something as simple as oxygen is not available in various parts of the country, and especially even in big cities which have some kind of a health setup, functioning health setup. Even there, the things seem to be collapsing, and it takes the intervention of the courts to make oxygen available even for the national capital of Delhi. So I think right now what the government has to do is to unleash its might, its resources in providing effective treatment to the people such that they don't die for want of simple drugs like steroids or other drugs which are required for home management of COVID right now, for lack of oxygen and all. So this is what the government should be focusing on, and apart from that, it should take all measures necessary to boost up vaccination, though that is still a measure which would work in intermediate or slightly longer term. It will not really help in stopping the transmission of the virus immediately, because vaccine also would require 2 doses with a gap of 6 weeks and all. So but the deaths are taking place today, and we need to prevent those deaths.
Yeah, we saw images of people, affected people waiting in line, getting the help that they need. A lot of people are still waiting to be tended for in hospitals. How much stress is there? I mean, is this current surge is putting on India's hospital and medical resources?
Well, I think the medical system has literally, it has all but collapsed. Okay, and you have hospitals, private hospitals catering to medical tourism. Otherwise, they are now sending SOS messages on social media that oxygen supply left for another 15 minutes, another half an hour and all. And we have had at least 3 big instances in Delhi wherein people died in leading private hospitals, including some of the doctors, for want of oxygen. So I don't think I can encapsulate the suffering and the enormous poignancy of the current situation in words. I don't have the words to sum it up.
Yeah. Dr. Rani, let me go back to you. This variant has been detected in other countries as well, in some parts of Africa. Last time we checked. What does that mean for pandemic control globally? I mean, how can countries avoid surges?
You see,
It's yet another sign of how humble we have to be about this
only
virus.
way of
Sorry,
avoiding.
Dr. Rani, go ahead. And Dr. Dr. Rani, go ahead.
Yeah.
So I would say
Shall I
it's yet
continue?
another sign of how humble we need to be. Oh. How humble we need to be about this virus. It is a virus, and as long as it continues to spread unchecked in countries across the globe, including in parts of the United States, mutants will continue to arise, and we will see new surges. The two ways to control this virus are first, the non-pharmaceutical interventions, social distancing and masks, and having good ventilation if you're indoors. That's one way to control the spread of the virus. The other way to control it is vaccines. If we're not using one or the other or both of those methods, we will continue to see surges across the globe. And I am quite concerned for our countries in sub-Saharan Africa as these new variants spread.
Yeah, I know we're talking about South Asia, India, and Nepal in particular, but I'm really tempted to ask you this, as a former U.S. correspondent. How would you assess the current situation, the COVID prevention situation in the U.S. now with this aggressive vaccination campaign going on?
So we've seen a dramatic decrease in the number of cases, hospitalizations, and deaths as we get vaccines out. So as we got the age 65 plus group largely vaccinated, we saw hospitalizations and deaths go down by approximately 90%. Now we're seeing similar drops in younger age groups. But the place where we may get hung up is with folks not getting the vaccine. There is very uneven uptake of vaccines.
Which is
across
half of the population yet to be vaccinated?
So, yeah, so right now around 40. So there's not a single number. Every vaccine that goes in an arm prevents not just an infection of that person, but also the community around them. So if we're at 40%, 50%, 60%, every increase in percent of people vaccinated will help stop surges. And most importantly, will help stop that kind of healthcare system overwhelm that India is currently experiencing. The trouble is some of our states, Georgia, Alabama, Mississippi, have vaccination rates around 20%, which is not sufficient to stop future surges.
Yeah. It's really good to see things finally turning around over there in America. Dr. Pajpai, let me go back to you. India's principal science advisor says a third wave in India is only inevitable, given the higher circulation of the virus there. And with the health system cracking in many places, does India stand a chance against a potential third wave?
See, the question of third wave, I think, is still something which can be, which is to come. Right now, there is no sign of the second wave abating, and people continue to suffer from that. I think the way the scientific advisor has raised the issue of third wave is basically to distract attention from the failure of his government to be able to provide, take effective measures for tackling the second wave. So, my concern would be that yes, we need to provide effective relief to the people as regards the second wave, and in the course of time, as we go along, making these efforts, we need to be very cautious and take measures to prevent further resurgence of it when we anticipate it. So the preparation for that has to go. But the issue right now is tackling this wave, which is not yet abating in any way.
I mean, it's a tough question. It's a very tough question indeed. But what will be your best guesstimate on when can we see, a turnaround in India? When can case numbers peak, perhaps, in India?
You see, the thing is, well, I mean, I can give you an estimate, and that will serve the purpose for the bee. But have such things, such guesstimates really helped? Today we've had a news coming from the U.S. that the number of deaths from on account of COVID have been double the number which was anticipated in any way. So I think we can, while they can be deliberation on such questions as to what is the likelihood, what is the what the mathematical models will predict, and all those kind of things. But I would still focus on what is the need of the hour. Mind you, we had a mathematical modeling exercise which told us that gave us huge numbers of people likely to be affected and the deaths that will result and all, and it led to imposition of a lockdown when we just had a few hundred cases all over the country. And that lockdown led to enormous misery, to a huge mass of humanity that inhabits our country. The migrant labor, the way people walk thousands of kilometers in scorching heat back to their villages. So I would rather be cagey about this kind of quote unquote scientific speculation of any kind, and would still insist that the need of the hour is people be provided relief today and now at this moment.
Yeah, Mr. Pachpai, India and Nepal's crises have the region on high alert, to say the least. In Bangladesh, an ongoing nationwide lockdown is extended until mid-May. In Sri Lanka, we saw the total number of confirmed cases topping 115,000. Schools there have been shut and people have been urged to stay at home. Is India's COVID-19 crisis spilling into its, Asian neighbors?
Well, if India could get the virus from countries really far off from us, why can't our neighbors get it? You know, that is in the nature of these pandemics, and I don't say that it has to necessarily happen that way and all. Of course, all these countries, their governments need to take precautions, but then we know the way pandemics spread. We know what all developments have happened in the world, in its economy, in relations between countries, in travel and all that, which facilitate this kind of spread. And insofar as immediate neighbor is concerned, countries like Nepal or Bangladesh and all, I mean, these are not just other countries. People across the borders between India and these countries, they are culturally attached. They have blood relations. They have they have economic and commercial relations, and also there is every possibility of this happening. Now, I would, if you may permit, I would just briefly dwell upon the earlier question which I was about to answer. That is what the world needs to do. You see, I think this has been emphasized by many people that they, rather than being an isolationist, rather than being very parochial, resorting to parochial nationalism in the name of serving national interests and all, the best policy forward for the world is to see it for what it is. That is a global problem. This is not a problem of just individual countries. We had vaccine nationalism, and which I think, if it were not there, would have served the efforts against this pandemic much more. What we need today is that all technologies.
You're absolutely right, sir. We are in this fight together, and I'm afraid that's all the time we have. Thank you so much for being part of this discussion, and thank you, Dr. Rennie. And that would do it for this edition of Dialogue. Thank you all for watching.